Yeah, we'll talk about it.
All right. So I'm sure as kids, everybody has played some form of sport or have watched sports. They are good for our children and adults in staying active and healthy. However, there are many risk factors in playing sports. Two main risk factors and points that I'll be touching on are unhealthy competition and violence. So I'll play a clip for you from YouTube that shows how violence is.
Leaning forward, flags come down. Oh, there's punching now.
Finnegan and Andre Johnson going after it. Both of their helmets were ripped off.
Oh, it's continuing. It spills over.
Continuing the sideline now, the Texans.
Video.
Because of this action right here. Finnegan gets the first shot, then gets his helmet knocked off. He takes off Johnson, and now Johnson is going to get a couple of good shots in there, or a bad shot.
So whether you were there or not, you can obviously tell that sports is apparent, and how it's present in that. And so, seeing that, athletes are not always knowledgeable about how the severity of certain injuries, such as punching somebody in the head, could affect them long term. And so the two main points. The two main points that I'll be touching on are the unhealthy competition and the violence, and how injuries come from both of them. So starting out with the competitive aspect of sports, it is present in both youth and professional sports. Sometimes people don't think that youth sports has the competitive and unhealthy parts of it. And so one thing that can stem from unhealthy competition is eating disorders. And that's common in all sports, such as like football, volleyball, wrestling, cheerleading, all of them. And according to the Grady Journal, as athletes become more competitive and see increases in their performance as a result of dangerous dieting techniques, it becomes increasingly difficult to persuade them that they are harming themselves. It's a mind over matter, and if you don't have the right diet for a particular sport, then it could also affect you. So if you're not eating enough for, say, swimming, you can pass out because of not having enough food in your system. And it's also apparent in wrestling too, which is an example I'll use from an 18-year-old boy named Justin Kelly who was in high school wrestling. He says that we wrestlers do kind of abuse ourselves, but if the wrestler commits himself to a weight class, he should be required to stay at that weight by doing what he has to do. So they also show that the athletes know that they are abusing themselves and they choose not to do anything about it. And there's also pressure from parents on their children to behave and look a certain way and to perform a certain way. According to Reagan McMahon on the San Francisco Chronicle website, he states that previously kids played multiple sports seasonally and usually didn't specialize in one sport or get serious about team sports until middle school or high school. Now kids often play one sport all year long, which has caused a dramatic rise in overuse injuries. So playing one specific sport and having the pressure of parents having certain things and having certain competition involved, they are overexerting their own bodies, which create injuries. And people tend to not realize that you're not supposed to be playing on an injured leg or shoulder and stuff like that. Which brings me to my next point, which is violence. And that also causes overexertion of the body because most athletes aren't knowledgeable of certain injuries that they have. And so the most common injury due to violence is a concussion because you're taking blows to the head, and also head injuries. According to scientificsite.com, head injuries have long-term effects. Brain damage caused by concussions may result in strokes, paralysis, headaches, and mental clarity. A 2009 study commissioned by the NFL reported that Alzheimer's disease or other similar memory-related diseases appeared in the league's former players at 19 times the rate for men ages 30 to 49. Also, boxers who are exposed to repeated head trauma have a higher risk of progressive Parkinson's disease. So, untreated, you can also get a prolonged and more progressive effect of diseases such as memory loss and Parkinson's. And now the 10 injuries in sports, these are the most common, and runner's knee is the #1 in not being treated, which is the overuse, and it leads to irritation right below the kneecap, which most people in sports have to have knee surgery done because they don't have it treated. And a shoulder injury is also the overuse of a muscle, and it loosens your rotor cuff, which is the muscles and the tendons connected to your shoulders that allow you to move, say throw a football. And then the next one is the ankle sprain, and those are mostly unavoidable due to rolling your ankle in sports such as soccer or football. But you need to get it treated by saying tape it up or something, because it's really bad. It could lead to having to have ankle surgery. The next one's the tennis elbow, and that's the most common in tennis and golf players, and that's just overuse of the motion for your arm. And then there is also the pulled muscle, and that is mostly caused by not warming up properly, fatigue, and lack of flexibility. Lower back pain, it's mostly due to improper stretching and not warming up and just not knowing the position that you're supposed to be in for your body. Shin splints has intensity of working out incorrectly, so if you're not used to working out and then you have a very hard workout, you will probably get shin splints. And it's also common in cross-country runners where they're running on concrete. For the groin strain, it's mostly common in football and hockey because of the sudden change in direction, so you're pulling that muscle. And for concussion, it's mostly for violence, but all of these can be related to violence. And that is blows to the head and can cause permanent brain damage for the long term. And then the last one, which is the Achilles tendonitis. That is due to straining and overuse. If it becomes untreated, it can become chronic, and the injury will worsen, and you will probably it will become impossible to run. So in conclusion, I hope that you feel all more knowledgeable about how the dangers of sports can come about, and that you know how to avoid all of the different risk factors in it.
All right, Sung, what did you think?
I think her speech was really nice because she had a clear topic sentence, and it was well organized in 2 main points. And she started with a video short clip, I liked it, and she uses some quotes and citations, help express her ideas, and put examples, factor data. But for when she explained about injuries, I liked it, but I think it was long. Yeah, it would be better. It was short, maybe 5 or 5 examples. 10. I think 10 injuries were pretty long. Yeah, but I like the speech.
Okay. Well, I'm with you on the list. I think once you start getting to a list that's 10 items long and you're going to be talking about each of them, it's like my eyes start to roll around going, oh, come on, let's get focused a little bit more here. Yeah, the dynamic opening with the video clip that you're showing us, and so I think you get people, unfortunately, a little pumped up because